Not one N95 mask left.
Only masks we have left are these, which are not protective.
That's just part of the struggle Dr. Mariam Zainadine says family doctors are facing in battling COVID-19.
You have to have a mask, you have to be able to have a gown, and we've had, put some of our staff and doctors at risk, even going out in the car and testing patients potentially.
Staying outside to avoid bringing the virus into waiting rooms. The federal government has said it's working on a plan to secure and distribute supplies. Even if that were to happen, she thinks the better solution is triaging centers, designated places for anyone with flu or coronavirus symptoms.
Because otherwise we're putting all patients at risk, including all the physicians, community care physicians, including family doctors and their staff, and all the other non-COVID-19 patients at risk.
The province's medical health officer says local health authorities are looking into the idea and in the meantime trying to support clinicians where they can.
In other communities, they're looking at more innovative ways to make it easier for people so that they can come in on a set time and not have to be in a physician's waiting room, etc. So those discussions are ongoing.
The people responsible for supporting doctors are also concerned. Nurses say they are overworked.
So we were struggling already. Nurses work about $162 million worth of overtime. That's the numbers we have from last year. That's about 2 million hours of overtime.
Sorensen says they've sounded the alarm for years, and the nursing shortage will only be exacerbated by COVID-19.
If we have large numbers of patients who are positive for COVID, who require acute health care in an ICU or an emergency department in an ICU, that's the concern, is can we manage when we already have a healthcare system that's at 100% capacity?
There's no quick fixes, but both Dr. Zainadine and Sorensen say the community can help, slowing the spread of the virus by washing hands, avoiding large groups, and staying home when sick.
Nurses, of course, will be ready when patients come into acute care, into our emergency departments, but we would like that to be a trickle and not a flood.
One of BC's largest unions is asking employers to drop the requirement for doctor's notes.
It's a huge burden on doctors who should be caring for sick patients and not filling out doctor's notes.
They're hoping it will remove another hurdle as we all do our part to stop the spread. Leanne Young, CBC News, Burnaby.